Good afternoon, everyone. My name is Megan Johnson, and on behalf of Carosoft Technology Corporation, I'd like to welcome everyone to our second part of our webinar series with Qlik and IPC Global, Data Analytics for Beneficiary and Claims Insights. With that, I'd like to turn it over to our presenters. You can take it away from here.
All right. Thanks a lot, Megan. So let's jump right into this. We got a lot of great material today, so we want to make sure we've got time to get through it all. So let me jump over here to the agenda. All right, so what are we going to talk about today? I'm going to give you a quick high-level overview of the Qlik Analytics platform, kind of what it's all about, what makes it different, and then I'm going to jump right into the demo, the fun part of today's presentation. The good portion of the demo is going to be from an end user perspective, just so you can see how you can gain insights in your claims data, just using the power of the Qlik Analytics platform. Then I'm gonna pivot a little bit and put on my power user hat, so show you how you can actually create a Qlik dashboard on the fly. Then we're going to pivot once again, and I'm going to jump into a demo of Qlik Answer. So this is a newer capability. It takes advantage of generative AI technology on your unstructured data. So I'm going to show you what that looks like. And then I'm going to pass the baton over to Alex, who is going to run through a little customer story of how they're able to use Qlik to help out a healthcare organization, and then finally we'll end with some Q&A. So what is the Qlik Analytics platform all about? You can see I've got a few different Qlik dashboards here at the top, and you might say, okay, well, you can build out some really nice looking dashboards with Qlik, and you absolutely can. But the thing that really makes Qlik unique is its in-memory analytics engine, or you'll hear it referred to as an associative engine. And what it does, it allows you to generate your analytics. You can almost boil it down to 3 steps. So the first step is you select your data. So wherever your data lives, whether that's data that is on-prem, it's internal, it's external, it's located in a database, or it's a set of files, or it's API or data that you can access through API. Qlik is really good about allowing you to grab those data sources wherever they might live, combine them together, and then you combine them into one fully connected indexed data model. And then the third step, once you have your model created, then Qlik actually makes it very easy to connect and join those different data sources together. The last step is you system or query-based BI system. So pretty much all the other technologies out there are going to use a SQL query-based technology behind the scenes, which essentially is going to give you more static sort of views of your data. It doesn't allow you to interact and pivot and move around in your analysis nearly as easily. And so Qlik will give you, will answer the questions that you have, but it will also provide additional information along the way. Qlik also has AI and machine learning that's built into the platform that allows you to do things like just ask questions. You've got a certain question you want to ask. Instead of actually clicking around a dashboard, you can just type the question and Qlik will answer that question. It'll actually also automatically generate visualizations that can provide additional information and additional context. We also have alerting. So you might be tracking critical metrics within your organization, and anytime a metric exceeds a certain threshold that you're comfortable with, you can receive an alert on your phone or in your email inbox. And so Qlik can support things like that. We can also do predictive analytics as well. So you can actually create and train machine learning models that you can use to make predictions within your analysis. Lastly, the last thing I wanted to talk about in regards to the Qlik platform is that it is a true enterprise platform. So as the number of your users grows, as your data sources and your use cases, as they inevitably start growing, once you start using Qlik, it is going to scale and scale in a way that really makes sense, where you have proper guardrails in place. You can control exactly which resources users are able to access, and you can secure the data all the way down to the row and the column level as well. All right, so that was a real quick flyover of our platform. What I want to do now is I want to jump right into the actual demonstration. So let me go ahead and switch my screens over here. And I'm going to expand out this screen just a little bit as well. And maybe I'll refresh the browser just in case it's timed out on me. Oftentimes we'll do that. And so what are we going to, how are we beginning this? So I'm going to start by putting on my hat as a federal healthcare agency analyst. We're always looking for ways to maintain or improve, the same high level of care. But we also want to identify areas of high cost that can be addressed and improved upon. So what I want to do is I want to start out by looking at just kind of the number of claims in the current year that we are analyzing. So what I'm going to do is I'm going to use what we call our Insight Advisor, and just click this button here. And I want to see the certain apps that I have access to. So I'm going to select the apps, and I can see all these different apps that I have access to. And I'm going to select the Beneficiary and Outpatient Analysis app. When I do that, it's going to show me all the different metrics, all the different KPIs that I have access to get more information on. As I mentioned, I want to look at the current year number of claims. And it's going to go through, and it basically went out to that app. It used that in-memory engine I was talking about before, and it's giving me the specific number of claims that have occurred this year. You can see it's about 123,000 claims. Now this is interesting, but I want to have this broken out by claims diagnosis. So I'm going to say, show this by claim diagnosis. And this is where the natural language processing comes into play that I mentioned before. And after I type in this question, it understands the context of the conversation. It understands that we're still talking about current year number of claims. And you can see that on the fly, it's generated this bar chart that answers my question. So I can see the top claim diagnosis is very long, a long claim diagnosis, but it's followed by the diseases of the circulatory system, and then followed by endocrine, nutritional, metabolic diseases, and immunity disorders. So you can see it all fully broken out here. And you can see it also has done some natural language generation towards the bottom, where it's highlighting some interesting things that's going on here as well. And so, this is great because it's almost like, Alexa or Siri, where you ask a certain question and you're able to get an immediate response back. You don't have to do any sort of coding or complicated expression development or anything like that. And you can also see there's this link here to it says explore this. So what I want to do is I'm going to click on that link, and it's going to take me directly into the app where it was able to generate that answer for me when I was asking about the number of claims. Because I'm going to have some more questions I need to get answered. I have some more analysis I want to perform. And when it lands me in the app, what it's going to do is actually going to land me into what we call our Insight Advisor search that's built directly into the app. And what this does is it allows you to actually do the same type of thing where you can ask a natural language question directly within the app, and it's going to generate visualizations that can answer your question as well. And you can see that now it has is showing me this bar chart here, or should show that in just a second. I think my Wi-Fi is running really slow at the moment. And it's same exact bar chart here. So it actually brought over that question that I had before. So at this point, I could start analyzing this information a little bit more. You can see it's giving me again the same highlights. It's giving me also this table down here. You can also see there's an add to sheet button here on the visualizations as well. So if I wanted to actually build out a whole kind of report around these visualizations, I could just click that add to sheet button. But instead, what I'm going to do is I'm going to go out to my main dashboard. And from this view, we can see kind of the main crux of what we're going to be analyzing today. So as I mentioned before, we are looking for ways to identify areas of high cost or cost increases, and we want to be able to address them appropriately. So we can see on the left-hand side, the critical metrics that we're tracking here, claim amounts per beneficiary. We can see a breakdown of current year versus prior year and these line charts here. And then we have a map view as well. It's giving us some additional information about cost increases. So, maybe I'm an analyst and I'm really focused on patients with COPD. And, I've been asked to find areas of cost increases just so we can address them appropriately. So I'm gonna come over here to chronic conditions and I'm gonna look for, here we go, chronic obstructive pulmonary disease or COPD. When I make the selection, you'll notice a few things are gonna happen. So the selection that I made is gonna show up here at the top. And you can see that all the numbers, all of the charts, everything is now going to be focused around patients with COPD. You'll also notice in the header here, it is giving us essentially a dynamic update of the number of beneficiaries and claims that are being analyzed. So when we started out, if I remove my filter, you can see that we were looking at a little bit about a 500,000 beneficiaries and 3.9 million claims. And if I reapply my selection, you can see that now it's going to update to the number of claims, the number of beneficiaries where there are COPD patients involved. Now, if I'm looking at this, everything kind of actually looks good from my perspective, because I can see that our number, green is good here. I can see that the claim amounts for beneficiaries have improved. They've gone down since last year in both of these metrics. So that is great. And again, as I mentioned, everything else has updated accordingly. Now, I'm interested in actually looking into where costs have increased from the current year or from prior year to this year. And maybe I want to look at this from a geographic perspective. If I look at my map here, I can see clearly that Vermont has had some cost increases. Looks like Virginia has as well. Looks like North Dakota. So just by the shade of the colors on the states, I can see where some cost increases have occurred. The other thing I can do, if I click on show density, this is actually going to bring in an additional layer. So this heat map layer is actually showing me where there are folks that are submitting a really high number of claims relative to the average number of claims that are being submitted. You can see in the kind of the Northeast Mid-Atlantic area. So that could be another candidate or area where there could be, we could look into to see what's going on there as well. So I'm gonna go ahead and hide that layer. But maybe again, I want to look into states where or locations where we've had some cost increases. So I'm gonna go ahead and I'm going to just select this particular range here on the map that I want to look into a little bit. And there we go, actually. There we go. And I'll confirm my selection. And if I zoom in here to the Northeast, where I was seeing that high density of submitters with a high number of claims are being submitted. And actually the size of these bubbles are also giving me another indicator of where by city, where there's a high number of claims being submitted. And maybe I've been asked to focus in on Connecticut. And when I zoom into Connecticut, I notice that just by shade of this particular city, Middlesex, they have a high number of, or the cost increases have gone up from last year. And I want to look into this. We'll go ahead and select Middlesex. And now what I can do is I can actually see that how the claim amounts per beneficiary have increased here. Actually, a pretty big increase from last year to this year. You can see that that's gone up about $6,400 per beneficiary. So that's something that I definitely might want to look into and to see what's going on here. And I can do that. Actually, I can get all the way down to the individual detail record by moving over to another view within my app. So I am currently on the main dashboard here. What I'm going to do is I'm going to move over to my beneficiary details. And by the way, I should have mentioned this before, but this particular app that we're using, this is actually an app that we built out for a federal healthcare organization. This is using test data or mock data, so nothing sensitive here, but this is an actual app that we built out for them. And now you can see that I moved over here to the beneficiary details. We're still just looking at patients with COPD, in this case, located in Middlesex, Connecticut. And what you'll notice is something really stands out here, right? You've got this particular beneficiary over here, Guze. I'm sure that's just butchered that name, but I think these names have been scrambled. And anyway, you can see that the total claim payment amount is way more than anyone else here. So this is a clear outlier. This actually might even be a clerical error. This could be something that we want to look into. So what I want to do is I'm going to select this particular individual. And what's nice with Qlik is that anytime you come across a certain finding and maybe you need to actually share this out, you want to share this finding with others, what I can do is I'm going to just actually take a note or actually take a snapshot of this note. And what that's going to do is it's going to take, again, a snapshot, I'm sorry, it's going to take a snapshot of this visualization. It's going to allow me to create a note around it. So I'm going to say, take a look at this beneficiary. Numbers are really high here. And I can even tag somebody else in this. Maybe I want to tag my boss, Dustin Baxa, in that note. Whoops. And what's nice is this note is out there. And as soon as I tag this particular individual, what's going to happen is they're going to get an alert letting them know, hey, they've been tagged in this particular note. And they can get an email, and they can select in that email a particular link that's going to take them right back into this dashboard with all of the selections that have applied, so Dustin can now look into and see what's going on here. And he might say, oh yeah, that's actually a clerical error. This clearly got entered in incorrectly. And at that point, what he could do now is he could actually take advantage of this in-memory associative engine that I talked about before. He can come up here and you can see that Guze is currently selected because she's highlighted, or he or she is highlighted in green here. But what he could actually do now is say, hey, you know what? I want to look at everyone else except for this particular individual that has COPD that's located in this particular county. They can just say select alternative. When you say select alternative, what you're going to do is you're going to take the entire data set, basically all of these light gray values here that you can see. Whoops, let me click off this. All of these light gray values, they all indicate beneficiaries who meet this criteria, but that are currently not selected. They're called alternatives. So I'm going to say select alternative. Basically, I'm going to take this entire data set, spin it around on my finger, and now we're looking at just these patients, and I've kind of removed that outlier. And what's interesting now is if I move back to that dashboard that I was on before, and I move here, you will notice that the costs actually, the claim amounts per beneficiary have now decreased. They've gone down because we had this one particular outlier, this one particular individual who's completely driving up the costs. But because I was able to kind of basically pivot my analysis, remove that outlier, now I can see that the costs actually haven't increased in this particular geography. So that's an example of where, hey, you're able to use the power of Qlik's engine to kind of navigate, move around in different directions, come across a particular finding, write a note about that finding, tag somebody else in it, and then they can go in and say, you know what, I'm going to remove that outlier. And when they do that, you can see, hey, now we're looking at some more accurate data here. So really taking advantage of Qlik's ability to give you the ability to pivot and move in different directions in your analysis, just like I mentioned before. All right, so I'm going to go ahead and I'm going to remove my selections here. And what I want to do now is I want to do a smart search. I want to actually look into, we've heard that claim amounts have gone up for alcohol or drug focused hospital provider types out in the West Coast, particularly in California. And I want to look into this. Now, I don't have a hospital or provider type drop down here, but what I can do is I can use my smart search and I can just search for, I'm gonna just type in the terms that are related to what I'm interested in, if I could actually type correctly, alcohol. And what Qlik does is it scans across all of the data that I have within my app, and it'll actually start predicting what I'm interested in this case, alcohol slash drug. And I want to look at these provider types in California. And you'll notice here that the very top selection that is giving me is looking at this type of institution or provider in the state of California. This is exactly what I'm interested in. So it's just like a Google search. When I do that, now it's going to reorient the entire dashboard to just folks that are in this particular type of hospital in the state of California. And you can see that looks like the costs have increased. You have this red here showing me the change from last year. So the costs have definitely increased. So that is exactly what I was looking at. And this kind of confirms that. And what I can do now is I can also look at some of the filters here that are being used as well. And I can see that there's this, I was kind of showing that this green, white, and gray color scheme before. If I come over here to claim diagnosis, y'all see this little shade of gray that's showing up here as well that you can see here. And so this is showing me all the different claim diagnoses that are relevant for beneficiaries in this type of hospital provider type in California. But then you've got a couple claim diagnoses that are grayed out. You can see this has something to do with a couple of these have something to do with pregnancy. Now, this might actually be the case where that's not relevant here. But maybe we know that we had some patients in this type of hospital in California where this claim diagnosis actually was relevant or actually did come into play. All of a sudden we're going to see them grayed out. And so we might want to figure out, okay, what's going on here? Why are these grayed out? And then I can kind of go down that path of investigation using this color scheme. In a query-based tool, as I mentioned before, that we're very different from, a query-based tool, you would never see these values that are not related to my selections. You only get exactly what you asked for, nothing more, nothing less. Qlik actually will show you additional information so you can kind of start investigating other areas potentially if necessary. All right. What I'm going to do now is the other thing that Qlik is particularly good at is that it allows you to do comparison analysis. So, and a lot of times it can be really sophisticated or complex comparison analysis that you need to do. And so maybe as an analyst, I've been asked to compare claims for patients with diabetes using different demographic information for comparisons. So I'm going to move to my claims comparison sheet here. And when I move here, you're going to see at the top, on the left-hand side, you've got KPIs in blue, and on the right-hand side, you've got the same KPIs in red, and the same thing with the charts. So everything on the left-hand side of the screen is going to update based on selections that I make on the left-hand side. And the right-hand side is going to update based on selections I make on the right-hand side. So I wanted to look at specifically folks with diabetes, as I mentioned before. And we want to look at, because maybe we have a really large Hispanic population, and we're trying to do a comparison for males and females. So I'm going to select male Hispanics with diabetes. You'll notice that all of these blue numbers, everything is updating based on these selections that I've made. Now I want to do the same thing on the right-hand side, but for females with diabetes. And when I do that, you'll notice, oops, that all of these numbers in the red are going to update as well. The numbers actually look fairly comparable, except for I noticed that the total claim amount per beneficiary is actually quite a bit higher for females with diabetes. So this is an example where I might say, okay, looks like we've got a difference that I've come across, and maybe I want to look into this a little bit more. And maybe we've heard that that some of the numbers have been all over the map recently for beneficiaries with respiratory related claims. So we want to look at that, and specifically for women. So I'm going to come over here, and I notice we have diseases of the respiratory system. I'm going to go ahead and select this. And when I make that selection, it's going to drill into specific respiratory related claims diagnoses here. And you'll notice, as I mentioned, the numbers have been all over the map recently. You can see that we've had all of these different spikes here that have occurred more in this most recent kind of test data that we're working with. And so that does confirm what we've heard, that the numbers have been going crazy. So this might actually be a moment where I'm starting to think to myself, you know what, I probably want to create an alert. I just want to know an alert when numbers are really kind of spiked, or when we're seeing a really high volatility in our numbers. And so what I'm going to do is I'm actually going to create an alert. So I'm going to go ahead and just right click on my visualization here, and I'm going to go to alert, and I'm going to click create new alert. And I'm going to give it a title. I'm going to call this respiratory alert for women. And I'm only interested in the second group. So I'm going to go ahead and I'm going to delete this first group because we just want to look at the women that we've focused in on here. And we can split up this alert. We can show this by date or a lot of other dimensions here, but I wanted to stay with date. You can see I'm getting a preview by date of the claim amounts per beneficiary. I'm gonna go ahead and click next. And now this is where we can actually specify the condition for when we want this alert to be triggered. And so I could just be a simple threshold. Hey, anytime the claim amount per beneficiary goes above this certain number, I want to be alerted on this. In this case, because we're seeing this real high volatility, I actually want to be alerted based on standard deviations. So anytime the standard deviations, now we're getting some more complex sort of alerts that you can do within Qlik. You're probably thinking to yourself, if you're like me, man, I haven't heard standard deviation since my stats class freshman year in college, right? Like, I didn't think I'd ever have to worry about that again. All right, we're going to say anytime it's greater than 4 standard deviations, we want to get an alert. And we'll see, so it should give us a little preview of that particular alert. And we can see it does. And in fact, it's actually highlighting those dates here in September where we had some high spikes. So it's showing you what I would have been alerted on if I had already established my alert before. I'm gonna go ahead and click next and go ahead and hit create. And now I'm able to get an alert just like that anytime anytime there's high volatility in the claim amount per beneficiary for this particular subset of this patient population that I'm looking at, Hispanic women with diabetes. So what's great about this alert is that it's going to maintain that context. So I'm only going to get alerts for Hispanic women with diabetes. So it's going to eliminate a lot of potential white noise. If I were to create an alert just kind of the entire general population, I would have my inbox would be I'd be constantly getting pinged, right? But now it's only going to be for what I'm interested in as well. And then when I get that alert, what's nice is I can just click on the link in the email, and it will take me right back to this dashboard with all of the selections applied, so I can investigate what's going on right then and there. All right, so this brings us to their very first CPE question that we have, where we want to actually talk about alerting. So the question is, how are you currently alerted when critical metrics in your organization spike or decline significantly? So the first choice is, hey, we have a reporting analytics tool that provides similar or the same type of alerting. We view our reports on a regular basis to stay on top of critical metrics, and we react accordingly. We do not have any metrics or KPIs that are time sensitive enough to warrant alerting. And then the final option is we have no alerting mechanisms in place and could benefit from an alerting capability like this. All right, so go ahead and take a moment or two to cast your vote, and we'll go from there. All right, now I've shown a lot of stuff here. I'm gonna go ahead and actually clear out my selection state. I'm gonna go back to the main dashboard here. I've shown a lot of stuff from an end user's perspective, how you can gain insights, how you can drill into certain areas of interest and use the power of Qlik's platform to be able to identify outliers, and then really improve and do meaningful analysis using things like search, and do things like comparison analysis as well. Now, there might come a time where you're asked to actually build out your own view, or maybe you need to create your own report, your own dashboard. And this is where the self-service capabilities of Qlik can come into play. So if I go to my assets here, and I have you can see all the different sheets that I have been kind of accessing and navigating through. These are all public sheets that anyone who has access to this app could access. You also have this tab where it says My Own. So this is where you can actually build out your own views, your own dashboards, your own reports. And what's great is that, maybe I'm not a very super technical user. I don't really know how to code or build any sort of complicated expressions. What's nice is that I can take advantage of Qlik's AI and use Qlik's master item library to actually quickly build out my own dashboard. And I'm going to show you both of those and what they look like and what they mean in just a few moments. So in this case, maybe I need to build out my own reporting analysis that's focused on the chronic conditions of patients, and the impact they have on the number of claims and the claim amounts per beneficiary. So I'm gonna go ahead and I'm gonna say, I wanna create my own sheet. I'm gonna call this chronic condition analysis. I'm gonna go ahead and open up that new sheet. And you can see it kind of has a little choose your own adventure for how you can start creating your own dashboard. I'm going to click on this third option, or this first option here that says explore the data. This is going to use Insight Advisor. So I talked about before this AI that's built into our platform. This is a great example of this. So maybe what I want to do is I want to start out by looking at the current year number of claims, and I want to have this broken out by, in this case, by chronic condition. So instead of actually typing out that request, because I don't type long sentences or long phrases in these sort of presentations, I'm gonna go ahead and just copy and paste this particular request into Insight Advisor. So I said, show me current year number of claims by chronic condition. And what you're gonna notice what Qlik is gonna do, it's gonna use natural language processing again, and it's associative engine, and it's built out this beautiful bar chart for me that's showing me the number of claims. I can see ischemic heart disease is the number one, followed by diabetes and heart failure. It's also given me some highlights here as well. Actually, one highlight I want to highlight is there it says 1.8 thousand items in current year number of claims are not associated with chronic conditions. This may indicate a data quality issue. And actually, if you look closely at this bar chart, and I zoom in a little bit, you'll see that there's this little bar here. Well, it's really getting big, where the little dash is showing up. This is actually something that's very unique to Qlik, because what it is doing is it's showing you there's potentially a lot of number of claims that were out there where a chronic condition was selected, maybe checked off, but nothing was actually specified. All right. And so this is Qlik's way, because of the in-memory associative engine that it uses. In a query-based system, you would just not see this bar. It would just kind of get left behind based on the join that you set up. But with Qlik, we're able to show you that hey, there's about around 2,000 claims where there's no chronic condition was specified, and maybe one was selected. So always like to point out some of those interesting findings that you can see that's very unique to Qlik there. All right. maybe this time now, what I want to do is I want to compare the current year number of complaints of claims against the current year total claim amount per beneficiary by chronic condition. So a little bit more complicated here. I'm gonna go ahead and copy and paste that one more time. And actually, before I do that, what I want to do, this bar chart, I forgot, I'm gonna add this to my new sheet that I just selected. All right, now what I want to do is I want to have use this or submit this second request to Inside Advisor to do this comparison of number of claims against the claim amounts per beneficiary. And you can see that it has actually created this nice looking scatter plot for me too. So this is great. This is another visualization that maybe I wouldn't have thought to have used or created. I'm gonna go ahead and just say I want to add that to my chronic condition analysis. The other thing that you may or may not have noticed is in the request, it's actually put in bold some of the terms that is recognizing, in this case, chronic condition and current year total claim amount and number of claims. These are all examples of what we call master item or master dimensions, master measures. So I mentioned this whole master item library before. You might be wondering, okay, what is that? So master items are a really important part of the governance layer that's built into the platform. It allows, as a developer, when you're creating an app, you can define essentially these master items that you know are going to be popular for other users and when they go to build out their own views as well from a self-service perspective. So again, I'm not technical. Let's just say I'm an analyst. I'm not very technical. If I come over here to my master items, I can see all the different dimensions and measures that I have available to me. And I can see, average claim age for days. I might not have any clue on how to define that particular sort of expression, but it doesn't matter. All I have to do is point and click at the things that I'm interested in because it's already been defined. It's already been blessed for me. So the master items are great for giving you consistent, accurate results in your reporting. So the next thing I want to look at is, I want to look at, again, I want to stay on this chronic condition theme. So I'm going to just select chronic condition. I also want to take into consideration the race of the beneficiary. So I'm going to select race of the beneficiary as my second dimension. Like I said, my Wi-Fi is going really slow at the moment. Not claim procedure. 1 second, let me just remove that. All right, we want to look at chronic condition, race of the beneficiary, and then the third thing is we want to look at the current year total claim amount per beneficiary. And I'll go ahead and select that. And what Qlik is doing is basically by just going and pointing and clicking at the items of interest, instead of actually typing in a question like I did before, once I just select the specific items that I want to focus in on, it is going to, in a second, is going to automatically generate some visualizations that is going to be related to those particular items. In this case, it has built out this radar chart for me. Again, not a visualization I would have even thought of, but this is great for my analysis. I'm going to go ahead and add it to my sheet. And what I can do now is I can leave the Inside Advisor and I can come in here and I can actually start moving some of my charts around. And if I want, at this time, maybe I want to look at some of my top chronic conditions. And what you'll see is that it is now automatically, all of my charts are going to respond based on the things that I select. In this case, maybe I want to look at my Hispanic population. So without any coding, without any sort of technical nuanced things I needed to do, just by typing in a question and pointing, clicking at a couple of things, I built out a dashboard that can answer my questions around chronic conditions. All right, this leads us to our second CPE question, where we want to talk about AI and machine learning. So our second question is, we said, how are you currently using AI or machine learning to support healthcare claims analysis, resource planning, or other processes in your organization? You can see the first option is we use AI to analyze the effectiveness of various treatments and procedures for specific populations, recommending the most cost-effective options. Or we employ predictive analytics to do high-cost claims forecasting, i.e. identify which beneficiaries are likely to incur high costs based on various factors. We use ML or machine learning models and or AI to identify unusual patterns, recognize anomalies and fraud detection, or we use AI or ML in our operations, but for different use cases than what is listed above, or hey, we're not even using any of that stuff in our operations. Go ahead and make that selection. And I got moving to my last thing that I wanted to show, or kind of topic I wanted to show, which is Qlik answers. So what I'm going to do now is I'm going to move. Actually, I'm going to just cycle through. I think I got a couple of these questions here. There we go. Qlik answers. So this is, I mentioned this before, this is a plug and play Gen AI powered knowledge assistant. This is specifically for unstructured data. We've been analyzing all kinds of structured data so far, but this is specifically for unstructured data. So I mean by that is PDFs, PowerPoints, text files, things like that. It's great because it gives your business analysts the ability to just ask questions and then in real time get personalized, relevant answers back for their unstructured data. Qlik Answers is going to give you reliable and consistent responses with full explainability, meaning it's going to actually give you the supporting links that it used to generate the answers that it's providing, and it's completely out of the box, completely a self-service solution that you can begin using today. All right, so let's pivot real quick, and I want to show you what this looks like from staying in the claims theme here. I'm going to move over here, back over to our app, and I'm actually going to jump over here to a knowledge base. So Qlik Answers, the first step with Qlik Answers is you need to point this particular Qlik Answers to wherever your unstructured data lives. So in this case, what I am doing, or what we're using here, as I mentioned, we're staying with the claims theme. What I did was I accessed an actual publicly available documentation from CMS. Because there's documentation from CMS that's out on the interwebs called the Medicare Claims Processing Manual. And it is really large. In fact, you can only extract one chapter at a time. At least I could only find out how to do that. And what I did is I took down 4 chapters. Each chapter was a separate PDF. And you can see that it mounted to around about 1,100 pages. So these are big chapters. And what Qlik Answers will do is allows you to point to wherever your unstructured data lives. And in this case, you can I uploaded these files, but you could actually point to a particular, if you've got a document repository where all of your, or where most of your unstructured data lives that you want to Qlik Answers to interrogate for you. That's what you would do in more of a kind of production scenario. You would kind of point to that where your unstructured data lives. And so once you have pointed to it, then the second step is you just click this index all sources button. It will index, it will take a minute or two, so I'm not going to do that. And then the last step is you click the create assistant button, and it will create an assistant like this, just like this. So this is the fun part. This is where I might have a question. Maybe it's around claims processing policies, specifically around duplicate claim handling. And I want to know, okay, well, what policies does Medicare have for identifying and addressing duplicate claims? So I'm going to go ahead and put that in my assistant, copy and paste that. I'm going to ask this question, and you're going to see right away that it is going to immediately give you an answer talking about the policies that Medicare has for identifying and addressing duplicate claims. So this is great. I didn't have to scan through, all 1,100 pages. Now this is only 4 chapters there's at least 32 chapters in this particular manual. So you got to think about it. This is thousands and thousands of pages that are out there. I just asked this question and it gave me an immediate response. Now, this is only for one document. The real power of the assistant is when you've got lots of different documents, different types of documents, maybe from different sources, and all of those sources are potential candidates for being able to answer a question that you might have. And so you can create a knowledge base, like I was showing before, with hundreds and hundreds of documents or different types of documents. And so, all right, so it gave me an answer here. If I click view one source, I talked about this idea of full explainability before. You can see that it is giving you the exact, in this case, chapter that is referencing that particular PDF file, and it cites all of the sources that it's using to answer that particular question that I had. Now maybe we got a follow-up question. I want to know, this actually has to do with provider requirements. I want to know what documentation is required for claims involving durable medical equipment, or DME. So I'm gonna go ahead and just ask that question out here as well. And you can see now it says for claims involving DME, and it's to give me all of the required documentation. And it gives me, again, a source I can use. And then I might want to know, okay, well, what are the common reasons DME claims are denied, and how can these issues be prevented? Go ahead and ask that question now. What's nice is it's just like ChatGPT in the sense it understands the context of the conversation, the context of the thread that you might have out there. And now it is answering this follow-up question within the context of the prior question that I asked before as well. And again, it's giving me the sources. By the way, I can also thumbs up or thumbs down questions. So based on the answer that I'm getting. And so basically you can create a feedback loop that can be used to make sure that the right documentation is out there and is being addressed and accessed correctly to answer the questions that you may or may not have. Last question that I'm going to ask here is, what percentage of time are DME claims denied? Last question here. Staying with the whole DME or durable medical equipment theme. And it says, hey, I'm sorry, I don't have any information to answer that question, but I could help with something else. You might be saying to yourself, ooh, that's not good. It kind of flopped for you in this demo in front of everyone. Actually, that's not the case. This is an example where this particular question that I asked, there actually is no answer for it in the documentation that's being accessed here. So what's great about the Qlik Answers Assistant is that when it encounters questions that it doesn't actually have an answer to, it will simply say, I can't answer that for you. This is very different than ChatGPT. For any of you who have used ChatGPT for any extent of time, those times where you ask a question and then it confidently gives you an answer that is not actually accurate, called an hallucination. You don't actually have to worry about hallucinations like that with Qlik Answers. It will just simply say, I can't help you when it's not able to answer your question. So that leads us to our last CPE question. And then I'm going to be actually handing the baton over to Alex from IPC to talk about a customer story here. So what aspect of Qlik Answers has most excited you about, or what aspect of Qlik Answers has you most excited about how it could help your organization? Personalized relevant answers, multiple curated domain specific sources, the trustworthiness and traceability because it's showing you the links, lowering the burden of internal staff, quick setup time and time to value. Like I said, this is something you could instantly access and begin using today. Or the last option is, I'm more interested in AI ML capabilities in Qlik's other offerings. So that's the last option there. So I went through a lot of material today. We showed from an end user's perspective how you can, again, search across your data, how you could ask questions of your data, how you can interact with the map, interact with all these different visualizations and get immediate answers to the specific questions. We showed you how you can actually build out your own dashboard without being a technical user and just asking questions and pointing and clicking at items of interest as well. And then the last thing we just showed you, Qlik Answers where we pivoted and we show you how you can use this capability to actually get answers from the data, your unstructured data that you might have within your organization. So without further ado, I wanted to pass it over to Alex just to talk about a unique customer use case where his company IPC was able to use Qlik to help out a healthcare organization.
Thanks, Danny. Can you hear me?
Yep.
Great. Danny, if you can share the one slide,
Oh,
that'd
yes.
be great.
Yeah, let me do that.
So the healthcare system is located here in the state of Georgia, which is where I'm personally located right now. But before we go into the use case for a second, I want to highlight what you saw Danny highlight is how you can take data, specifically healthcare and claims data, and explore it to get the answers that you're trying to understand, to get insights, to set alert to potential problems that you may have or outliers that you may want to further investigate. In the case of what we're showing here with Northeast Georgia Health System, they're a healthcare system here in the state of Georgia, and one of their challenges was at times, and I think most health systems and government agencies have issues around potentially improper payments. And so in this case, the customer's challenge was, I have a patient who's participating in a research program that was done through a grant, that is part of that program, but that same patient may actually come into my health facility for other services. What had happened in a couple of occasions was, they were misallocating potentially where that transaction should fall. So um, I'm a patient. The transactions for my services should have been billed, associated and billed to the grant, but it actually was billed to the insurance, or vice versa. It should have gone to the insurance and not the grant. And so what that does, obviously, that increases a lot of reconciliation, a lot of work for the health system to try to get a handle on. And certainly as a health provider, that those types of errors have downstreams impact to their revenue cycle, their ability to forecast, accountability of effectiveness of the research program, right? So a lot of challenges associated to that. So this specific health system used Qlik in order to identify transactions from these two different disparate systems, to identify when I come in as a patient, and I am taking having an interaction with the health system as it associates to the research, it would automatically flag it and ensure that it goes into the right bucket. And if it were miscategorized, it would generate an alert so that finance can create and correct the miscategorization. As you can imagine, fixing these types of errors drove a lot of value to that healthcare system, because they were easily able to now ensure that they have clean patient interactions. They're not billing the insurance where they shouldn't be, and they're accounting for only the research interactions that should be accounted for. And so from the healthcare system standpoint, they were providing a better patient outcome experience, but also from their own management and finances, they were able to manage their back end office more effectively. We're about 4 minutes left. So Megan, I'm going to turn it over to you to see if there are any specific questions.
Absolutely. And thank you so much, Danny and Alex. We really appreciate you speaking with us today. We can go ahead and start the Q&A. If anyone has any questions, please feel free to use the Q&A pod at the bottom of your screen. It looks like we have a question already. Says, we use Power BI for analytics currently, and it's working okay. However, whenever we need to work with medical data outside of Azure, it's very challenging. We have to migrate the data into a single repository in Azure before we can even work with it in Power BI. How does Qlik handle data when it's not in one location?
Yeah, that's actually it's a great question because something that we hear a lot from organizations that are using Power BI. Power BI is a great tool when all of your data is in Azure, especially in like one particular system. But when you have data that's outside of Azure, then it can become pretty challenging. And that's actually, I mentioned this in that first slide that I showed. That's one of the hallmarks of Qlik is its ability to work with data and connect to data wherever it might live. So whether that is in Azure, whether that is on-prem, whether that is in AWS, you don't necessarily have to worry about migrating it all into one system like you may with Power BI. You can, it's kind of like to say, it's a come as you are sort of approach where we can connect to where your data lives, pull it in, and allow you to see the whole story of your data with potentially multiple disparate data sets that live in different locations. So great question, and something that Qlik is particularly good at.
Yeah, for sure. Thank you so much for answering that for us. It looks like we have another question. It says, I really liked Qlik answers. However, most of our file or unstructured data is stored in SharePoint. Can Qlik answers pull from that?
Yeah, I kind of was rushing towards the end, so I didn't really even get a chance to show you some more of um, uh, the data connections that you would typically use. So a lot of times, I just quickly uploaded a few files as examples of how you could use Qlik answers. So you can certainly do that. The more likely scenario, though, in a production setting is that you would use a repository, something like SharePoint, and that is absolutely one of the connections that you can use with Qlik Answer. So if you have your data, your file stored in a repository like SharePoint, you can absolutely connect to it and you're in business. And the nice thing about the Qlik Answer is that it's constantly being refined and data connections are being added to it. So other areas like Amazon S3 is another example. And we're adding to that list as well. So good question though.
Definitely. And it looks like we have time for one more question. So, on that note, our last question, we have very large volumes of data that we're dealing with in our organization, i.e., hundreds of millions of records. Can Qlik handle this as an in-memory solution?
Yeah, so that's a question that we get a lot of times that people are concerned about. And short answer is Qlik can absolutely handle large volumes of data. We have customers like the Postal Service, like the DoD that are working with literally hundreds of data sources with data in the hundreds of millions, even billions of records at times. And so you can absolutely do that. Qlik uses a compression algorithm on your data when it loads it in to memory, so that it only stores unique values one time. So you get very, very high compression rates on your data. So even when you're dealing with really large volumes of data, you're still able to get really fast performance as users are interacting with their dashboards. Today it was a little bit slow in the webinar. I think a lot of that was because I figured it out after the fact. Since I had my camera on, my Wi-Fi was acting a little bit slow. But in general, you're going to get really great performance, even with really large volumes of data like that.
Absolutely. And I believe at the top of the hour, that is all we have time for. So I'd like to thank you again so much for your insight in answering those questions for us. I'd like to thank our participants as well as Danny and Alex for being with us today. We hope the information you received during this webinar has been helpful.